Welcome to the 13th week of pregnancy, the second trimester. Congratulations. Do you want to know what's going on with your body? Special tips to be able to get rid of that nausea or that discomfort. Back pain, are you feeling heartburn yet? Do you have a tip for all this? Everything about your baby? What is already formed? What is forming his face? How he is? A feeding tip and a special tip for this week. You want to know all this? Stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very, very happy to have you here with me. Welcome to the second trimester of pregnancy. It's an honor for me to be able to tell you everything that's going on with you, with your little baby by your side, right? Going through such a special moment in your life, and I'm here glued to you. Thank you for the honor. Let me start with an explanation. Why are you in the second trimester? Seasonal, what's going on? What month am I in? There is a lot of confusion because there is a lunar calendar. Each moon at each moon phase lasts exactly 1 week, and a lunar calendar lasts 4 weeks, exact according to the lunar calendar. We do the quarter count, so you're in your second quarter if you're going to consider it. Our normal schedule. Then things get a little different. Shall I leave this table approximate for you? But it is variable according to the number of days in the month and can vary from 28 to 31. What's all this fuss about? When do we see each week? Then take the date of your dump so you know within our calendar which month you are. Just to give you an idea, if you had your dump on January 1st, this week would start on March 26th. I would go until April 1st. What a mess. That is, at the end of this week, you would enter the 4th month, right? It is difficult to make this account because if you got pregnant in another month, the account would already be different. So let's use lunar here. Welcome to the second trimester, and let's talk about you. How are you? Look how much your belly has grown now that your uterus is already on top of your pelvis. It's already coming out, right? It's almost 4 inches below your belly button. And this is already reflecting on the size of the belly. She starts to get rounder with this. It can also change her center of balance. We begin to change our body. So be more careful when standing up, especially because of falls. If you can retire high heels, everyone will appreciate it. And now because of this projection of the belly, you can have the famous pain in the foot of the belly, which is also called round ligament pain. Look at the name of it. You didn't have to call it that, did you? But despite this pain happens because your uterus is expanding and it's taking on new weight in that region. So it's possible that you start to feel pain that we call pain in the foot of the belly, right? On a daily basis, I will leave a video about it here for you, and it tends to increase. By the end of pregnancy, most women will feel it around the 3rd trimester. Okay. This second trimester is known as the best phase of pregnancy. Why? Because those discomforts of the 1st trimester are there in the past, and that weight, all that tiredness of the 3rd trimester, that the baby is already big, the back hurts more, there is more anxiety involved, are in the future. So it's a good time for you to be able to enjoy your pregnancy, the growth of your belly. Don't forget to photograph every week or at least every 15 days so we can follow how this growth is going, and nothing to worry about. Your belly is not yet that big belly of respect, okay? Each pregnancy is unique. Each genetics is unique. Some women already have a big belly at this moment. Others will have more at the end of pregnancy. For example, I had my bigger belly around 20 weeks. Until then, it just seemed like it was a draft beer belly. People looked at me sideways in line. Preference, yes. But I had the right and I continued using it. Another important thing is that because of your digestion talent, both because of the hormones of pregnancy and because of the peristaltic movements, which are those movements of the intestine to take the fecal cake down there, are compromised. Because they are being pressured there, by uterine growth. We have more emptiness and we unfortunately have more reflux. What does that mean? This means that if you have been drinking a lot of liquid during the meal, if you have been eating a lot of fatty foods, fried foods, these fast foods, the tendency for this to happen to you is greater. At the same time, if you have dinner and go to bed or lunch and go to bed, the likelihood of you having reflux and heartburn is also increased. So make small meals, distance a little from bedtime to get better. And when you go to bed, remember that hint I gave you before, but I'm going to give it again. What is it important to sleep? On the left side, your left side down in bed. Why? Because look, I'm going to leave it here again for you to see. This is our stomach when we are standing. When we lie on our left side, it faces down, which makes the gastric juice stay inside us. He's not going to keep coming back down our throat. It helps a lot. And in addition to helping with this, you leave a super important vein for our circulation, which is called vena cava. It is more pressed during pregnancy. And when we turn on the left side, this vein is more released. To be able to exchange blood in our body is to be able to increase our circulation, improve its quality. With this, you have a decrease in swelling, including improving circulation for your baby. So start training, lie on your left side. If you're going to lie on the sofa, stay on your left side and always 1 foot up to stimulate the circulation of your legs, to escape the swelling that is mainly in a mid-season. And let's get to my favorite part. Let's talk about this baby. You're hungry. Do you know how big your baby is? He's the size of a peach. The peach, but yummy, juicy, yummy of life. Oh, how delightful this child is already. We're going to talk about your baby's measurements from head to butt because it doesn't fit. It is not easy to measure with the size of the legs, not only by the position, but also by the genetic factors that are beginning to influence. Although the baby's development is always the same, what will be formed when it comes out? The sprouts, little fingers, or even mature organs the size of the baby, you will see that begins to give a varied. Even ultrasound loses its ability to date pregnancy correctly. If you do one now, calm down. I'll get to this ultrasound issue with you, huh? At 13 weeks, you should have done your first leuphology. But calm down. That being said, your baby this week is measuring about 6 centimeters and a half, may reach 7 centimeters, 8 meters by the end of this week, and weighing about 30 grams. He's growing up a lot, isn't he? Your ear is already in the right place. Your eyes are already straight. Your features are more and more defined. They are getting closer and closer to what your baby will be like at birth, but still skinny. He will get fat more there. At the end of the 3rd trimester, your head is still large compared to your body, but proportionally, its growth will be a little slower for your body to catch up. Baby is born your head refers to more or less a quarter of your size. They are born with big heads, and that's why our babies have ethereal gestation. We had to stop production there at 40 weeks of pregnancy, and it continues to grow outside the uterus because due to the intelligence of brain development, we have a larger box, and childbirth was no longer possible. So we had to anticipate nature, bringing the birth forward to 40 weeks, but our baby continues. He continues to have master gestation for a period, right, out of the belly, usually 3 months, which is exactly this period that he continues to grow, developing his brain, but it is now without the restriction of sizes that he would have inside the womb. The bones of the skull, which were once several fragments, begin to fuse. Calm down. There's still room for molara there, right? To be able to have a normal birth, this one will not fuse now and will begin to form the ribs. Your vocal cords that began to be produced last week, they are already formed, as well as your larynx, but we can't hear our baby because he is immersed there in the amniotic fluid, which tends to increase by about 50 milliliters now, and tends to increase a lot by the end of the pregnancy. Now that everything is formed, mouth, tongue, larynx, vocal cord begins a new process in development. Your baby began to swallow the amniotic fluid. This amniotic fluid goes to Silvio. Stomach will be filtered by your kidneys, will be eliminated by the ureter, will be swallowed again. It sounds gross, but it's no. Okay, everyone does this fetal urine therapy. And a very interesting thing is that in some ultrasounds, you can catch your baby peeing. I caught Lucas peeing on me, you know, and it's 1. 11 very important snaps even, which already shows that everything is working perfectly. The little rinse is working right. The bladder is working right. So If you can catch this moment, which happens more or less every 30 minutes, it will be a great show on your ultrasound and also a peace of mind in your baby's development. And look what too, the connections of your baby's brain with the muscles and nerves are formed. What does this mean? That now those involuntary movements begin to be more voluntary. He now starts playing, sucking his finger. You can pick this up in the ultrasound. Look how cute. He starts playing with his first toy, which is the umbilical cord, and he stays calm, okay? No matter how strong your baby is, he can't stop the flow there inside the umbilical cord. There will be no shortage of nutrients for him. You know what else he already does? He already stretches. He's soft. How delicious. Do I exist? But it is still believed that he already has a fingerprint, and even though they are identical geniuses, each has his own fingerprint, which is formed according to the movements of his little hand in the womb walking around there. Look how interesting. And tell me now here in the comments, if you have already done the first morphological ultrasound of the first trimester, it needs to be carried out by this week, because there will be some tests that you need, right, which have exact data from that moment. And the name of this exam is nuchal translucency, and evaluates whether there is an accumulation of fluid in the back of the baby's neck that may indicate an increased risk for some syndromes such as Down syndrome, for example. Look for the nasal bone too. And I'm going to leave a full video here for you about the morphological of the first trimester, everything that's looked for, everything that's looked at. Take a look at this video, which is really cool, but tell me in the comments if you have already done it. If everything is right, when there is any change in this morphology, you may be asked to take an exam called NIPT. NIPT is the birth of hygienomics, which will show through the mother's blood. You're going to do a blood sample on the mother, okay? It's not invasive. If there really is such an increased risk for diseases, it evaluates not only the sex of the baby, like a risk for genetic diseases, right? What are chromosomal diseases? I'll leave a link here for you too. What about the sex of your baby? Although it is completely formed, it is not always possible to see it on ultrasound. Some cases can see. It is usually good when it is a boy, but to have a better vision, it is more certain that from 16 weeks, however, some laboratories only release this information with 18 weeks. So before you schedule your ultrasound, call there at the lab and ask if you can do it at 16 or 18 for you to find out the sex of the baby, in case you haven't done fetal fixation or birth genomics. My food tip for 13th week of pregnancy is for you to invest in foods rich in fiber, for example, an orange with pomace. It is excellent. Why? Because your peristaltic movements, as I was explaining to you, they're slower, right? Which makes our intestine more lazy. That is more difficult to evacuate. And the longer our stool is retained, the more liquid it loses, the drier it gets. So we need to have a lot of fiber, because it increases the fecal mass, facilitating this movement. Pretty liquid peristaltic, not only nor for feces, but for the skin. To hydrate our baby, it is very important to reduce swelling, so liquid is always very important. And when you are ingesting all this fiber, it helps you avoid hemorrhoids in the intestine stuck for a long time. Exercising too much force can cause hemorrhoids, but rest assured that exerting force won't make you lose your baby, okay? They are different forces. That of childbirth and that of what we do to stay are different things. But in view of a lot of fiber in foods and cereals, it's mainly whole grains, okay? They help a lot and try to escape. You know about these medicines, even if they say they are natural, it is not always good to talk to your obstetrician before appealing to one of them, but sometimes it is necessary, so you have a resource there with him if it is an emergency. And my tip of the week is that you plan your vacation now for the second trimester. You can travel both by plane and bus. The car spots, do not forget that bus and car is important. You check the stops, will need to pee, there's no escaping that. And it's good to stretch your leg, walk a little, it will do you good. And in the case of a plane, you have to have a clearance from your doctor, okay? Airlines require your doctor to certify that you are fit to make that trip, and many airlines do not accept it. When we enter the third trimester, then we have to inform ourselves, including whether our intention is to make trousers abroad. I already planned this round trip so that it doesn't coincide after a few weeks. It varies depending on the company. Okay? There are some that are 20, they are 27 weeks, others 25. So check with your airline if you will be able to make this trip. But remember that you have to think about the return trip as well. And if you like imported product, but cannot or do not want to travel abroad, I will indicate this link here that teaches you how to buy at Carter's. Everything you can buy at Carter's for 500 USD. I do it step by step for you. And how do you get yours? The international card with a free account in the United States is a special condition for Brazilians who want a free account in the United States with Normad gives a dwelling in this link that is worthwhile. I hope you enjoyed these tips. Don't forget to leave a like. For me, it is super important for the development here of the Parents' Almanac. Mark a pregnant girl to be part of this hot family here, and I'll see you in the next video.